Hey, bro, how you doing? Long time no see. I was thinking about you. Hey, you remember back in high school when we used to care a whole bunch about hair, and we were always talking about like the growth cycle of hair and maybe hair anatomy and growth phases and stuff? Yeah, that was pretty cool stuff. Hey, so remember that one time we're trying to get those girls' phone numbers, and those girls are like, I bet you guys don't even know the 7 most common causes of hair loss. And we're like, psh, yeah, sure we do. And then we could only think of 6. That was the worst. Plus we didn't even get their phone numbers. Anyway, so I've been thinking about that, and I remembered all 7 now. And I was just gonna tell them to you in case you forgot. So the first most common one is heredity, right? What mom and dad give you. Psh, thanks, mom and dad, I'm going bald. Anyway, so heredity is the main cause for androgenic alopecia, which accounts for 95% of all balding in the whole world. That's for men, male and female pattern baldness. Okay, yeah, you got that one, I know. So the second one, remember, was hormones. We're talking like if you get pregnant, you're gonna have a baby, or after childbirth or menopause, when women lose a lot of hair, that can happen, right? Remember? Okay, yeah, and then whoa, remember like low thyroid, don't forget the thyroid, and maybe even diabetes, because insulin's a hormone, right? People who have some bad diabetes, they can lose their hair too. Right. Okay, now remember when those girls laughed at us because you're like, oh yeah, the next one is immune, and you probably meant autoimmune, because there's like lupus, which can make you lose your hair, or also there's that one alopecia areata that gives you bald patches all over the place. Yeah, remember Jakey? Yeah, he like shaved his head and had all those bald patches. We were calling him, hey, alopecia areata. And he's like, no, I shaved my hair to be cool. And he looked like a cheetah. High school. Don't you miss high school? Oh, man. All right. So then after that, immune, we're talking about infections, right? Like, remember when we was wrestling in the whole wrestling team, we all got ringworm, and then Tyler, he got it on his head, and he had all those patches, and then we're like, hey Tyler, go sit right next to Jakey. You guys look like the cheetah twins. And that was fun here back then. Anyway, going bald, yeah, you can get that from infections. Other infections, maybe like a really bad fever can make you lose some hair. And if you ever get syphilis, don't ever get syphilis, it's a mess. Okay, good. So then we got injuries, right? So really bad body burns, extensive or serious trauma, long surgeries can make you lose some hair. And even you ever heard like the traction alopecia? Oh, you know, like when we went to Jamaica and they gave us those cornrows and they were so tight, we thought it was a good idea, and we come home and we're like, oh, this isn't as cool as we thought it would be. And anyway, then we unbraided our hair and like it was falling out. Yeah, that's from traction alopecia or trauma to the follicles because they pulled it too tight. Yeah, okay, so then medicines, some medicines can make you lose your hair. If you start losing your hair, just talk to your doctor. There's tons, like anti-inflammatories, antidepressants, blood thinners, so many. Did you know too much vitamin A? You forgot that one. Too much vitamin A and retinoid can also make you start losing your hair. And then stress, if you're like so stressed, like bad things happening, going through a divorce, somebody in your family dies, bankruptcy, things like that just jacks your life up. Yeah, don't get those numbers, right? I'm stressed. That was a hard time. Anyway, so those are a lot of the things. Now, the other part is not just causes, but there's risk factors. We already talked like mom and dad thinks, yeah, genetics, all those other things, medicine, some of these other things. Did you know losing too much weight too fast? Who knew? Can make you lose your hair. There's so many. So anyway, I was just thinking, you and I should hang out some more time. I never see you anymore. Maybe next time we don't talk about hair so much. Let's talk about, I don't know, hats. All right, dude. Catch you on the flip side. It was good seeing you. Ciao.